Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with an October 23rd, 2020 COVID-19 update from the Dubuque County Public Health Incident Management Team. Dubuque County's case total today continues to climb, and with 357 cases in the last 7 days. Dubuque County will go over the 5,000 case mark this weekend. Our 14-day average positivity rate is still over 14%, which is much higher than the desirable 5% or below rate we want. And to top it off, the latest White House Task Force report released on October 18th still has Iowa and 49 Iowa counties, including Dubuque and the city of Dubuque, as red zones. This designation will continue until, as a community, we are able to decrease the community spread of COVID-19. The entire state continues to experience record hospitalizations, and the hospitalization indicator is a result of increased cases in the past few weeks. So this increase, including as we're experiencing here in Dubuque County, will likely continue until our daily case numbers go down. As of yesterday, 31 Dubuque County residents were hospitalized. That does not include residents from our neighboring counties and states who are patients at Mercy One or Unity Point Finley hospitals. Rest assured, though, our local hospitals have capacity for more patients, including COVID-19 patients. But it's not without stress on their staff and systems. As this increase in hospitalizations comes right before the start of influenza season, which also adds to the hospitalizations, it's critical that we work together as a community to take the steps we know can reduce the spread of COVID-19. So we continue to encourage community members to wear face coverings, maintain physical distancing, limit group gatherings, and practice good hand hygiene and sanitizing to minimize the spread of the virus. On a broader note, as the state's hospitalizations are at an all-time high, they're also on the rise in Europe. And the coronavirus seems to be spreading more rapidly in rural areas around the country. News from the CDC is bringing us changing guidance, and I hope you don't blame all the public health messengers here like me. But the definition of close contact or exposure has been modified. It now means someone who was within 6 feet of an infected person for a cumulative total of 15 minutes or more over a 24-hour period. Previously, exposure meant 15 consecutive minutes. So now we have to consider exposures added together over a 24-hour period. For example, 3 5-minute exposures for a total of 15 minutes over a 24-hour period. So why does the CDC keep changing what we're supposed to do? As more information and data is gathered from sick and exposed individuals who don't become ill, we're able to zero in on more refined criteria to determine what it takes for a true exposure, or how long it takes the virus to cause illness once you've been exposed. In other words, we're finding out more details and information on how the SARS-CoV-2 virus works. So keep in mind, data are limited, making it difficult to precisely define close contact. However, 15 cumulative minutes of exposure at a distance of 6 feet or less can be used as an operational definition for contact tracing. I'll be providing more information on exposure next week. But in the meantime, remember that being within 6 feet of others is a risk factor, so keeping space between yourself and others is so important, whether that's at a store, at work, church, or a social gathering, getting your hair cut, or at the gym. Lastly, a word on the vaccine development. Phase 3 trials are continuing, and yes, there have been a few pauses in the trials, meaning a side effect or something unexpected was experienced by one of the study participants. This kind of thing happens when vaccines or new drugs go through approval. Some may be alarmed by this, but really, we should be glad this close oversight, monitoring, and procedures for safety and approval are being adhered to. We don't have a delivery date for vaccine, and it most likely won't be here until December at the earliest. Finally, it's going to be a chilly weekend. Please keep in mind the new exposure guidance of 15 minutes of total time with another person within 6 feet as you plan your activities. And I recommend moving to more virtual events, curbside pickup at restaurants and stores, and thinking about the numbers of people you socialize with in person, keeping those to a minimum, especially since it's going to be tough doing things outdoors. Thanks for tuning in today. It seems like a long time since March when this pandemic surfaced, and we've been making so many changes to our daily lives. Keep at it, because we're all in this together.